Good evening. My name is Allison Halifax, and I'm a lieutenant for the Redmond Fire Department. I've been in the fire service for 22 years. I've been thinking a lot about what to say to you tonight. It'll be the last time I have the opportunity to address you as your employee, as I'll be terminated shortly. The first thing I wanted to mention is that I was at the Bellevue Council meeting last night, and then at least they had the decency to say the Pledge of Allegiance. The second thing I was thinking to myself was, how do I get council's attention? So here it goes. I wish I had been born a tree in Redmond. Trees in Redmond get compassion. Trees in Redmond get advocates, people that love them and care about them. Trees in Redmond have people actively planning and fighting for their future. Trees in Redmond are appreciated. Trees in Redmond are hugged. Unfortunately, I was born a firefighter. In Redmond, we don't have people that fight for us. We're fighting for ourselves. We don't have people planning our future, just the opposite. We have people planning our termination. Good people have stood before you all many times and have spoon-fed you facts, science, state laws, statutes, recommendations, LOAs, LOUs, federal law, EEOC guidelines, human rights requirements, and finally, and most importantly, personal stories. None of that has seemed to make a change on anything. On top of that, our own fire chief couldn't even look up from his computer when his employees were standing here in tears before him. You can do better. The overreach of power in this city is unacceptable. It goes against our Constitution and against human decency. Mayor, even if you can keep this mandate, you need to ask yourself, should you? No one is being fully protected by the injection. No one's being protected by us being terminated. The only thing being protected, you think, is your reputation. But I can assure you that even your reputation is not safe and effective. If you actually wanted us back, you would be the ones seeking out this information and looking for any shred of hope for keeping your valued employees. You would be the ones doing everything in your power to find accommodations and not deny negotiated ones. You would be the ones talking with other departments in the state and asking how they were able to keep their valued employees, but you haven't. Female firefighters make up 4% of the firefighter population. I don't say that to rah-rah feminism, as everyone who's ever worked with me knows. It's not my way. I bring this up to say that I've had to work very hard to stay in physical, mental, and emotional shape, although it might not look like it, to number one, put my coworkers at ease knowing that I could keep them safe, and number two, stay physically fit enough after having 2 babies in 2 years to keep up with the demands of the job. I've done that on top of that, during the same time, I've promoted twice and come out number 1 and 2 on my lists. I came back to work and trained diligently to ensure the safety of my crew. My lieutenant at the time, Matt Peterson, was regularly confused when I said I had to go pump. He thought the fire engine I meant myself. I had to store the breast milk in the community fridge at the station. I had to stay on my baby's feeding schedule while I worked 48 and 72-hour shifts. This included waking up during the small stretches of sleep we would get on duty and pumping while the rest of my crew got to sleep. It included pumping at the back of the fire engine after a fire and properly storing that milk as I was in a study with other firefighter moms. Our milk was being tested after fires for carcinogenic and other toxic materials so that we can ensure the safety of our kids. My family's made up of over 80 years of combined public service. We have police officers, dispatchers, and firefighters.
And in conclusion?
I'd like to say the Pledge of Allegiance.
And in
I pledge
conclusion?
allegiance to the flag of the United States of America and to the republic for which it stands, one.
You are?
All right. Hello. Thank you. My name is Callie Peterson, and I'm the wife of Matt Peterson, one of the lieutenants you're terminating after 15 years. The Redmond Fire Department got the very best of my husband and our family for these 15 years. In fact, we postponed our honeymoon for his interview, if that tells you anything about our commitment to the Redmond Fire Department from day one. I could tell you how we planned our summer vacations around the pancake breakfast, or how we never missed a year volunteering on the Santa truck. I can't even count all the holidays and birthdays and special events he missed over the years. I could tell you about the time I miscarried 3 days before Christmas while Matt was on shift, and I never dreamed of asking him to come home and take care of me and take him away from the people in the community who needed him at their worst hour. I could tell you how he's a founding member of the peer support team and the Redmond Honor Guard. I could tell you again about how as a family, we literally didn't see him for the entire first year of the pandemic, while he worked not only his normal shift, but an extra 1,000 hours of overtime alone, all COVID related. I could tell you about the hundreds of hours you invested into his hazmat training so he could raise the bar for Redmond and reestablish the hazmat team, creating protocols that were used around the entire zone. Or how we saw a need at the beginning of the pandemic for decon sprayers to decontaminate the rigs after calls. He figured out how to make those for a fraction of the cost, saving your department invaluable time and money. I could go on, and this is just one of the losses you are facing. I fall asleep every night trying to understand how all of that doesn't matter, and these amazing individuals are being reduced to a single personal religious decision. I think back to the last 2 years, and if you replace these very individuals with brand new rookies, would we be having this conversation today? Because it is fact that their experience, training, and preparation is exactly why we can tell you today that there were 0 cases of transmission and how we made it this far to begin with. Think about it this way. If you were facing a life-saving operation tomorrow, would you choose the experienced, trained doctor who's done this their entire career with a 100% success rate? Or would you choose the resident med student simply because they're vaccinated? Heaven forbid it was your child's life in their hands. Who would you choose? I'd like to address one of the comments made by a councilwoman during the meeting on April 5th. You stated how concerned you were for your child because they weren't able to get the vaccine yet. And I want to say I completely understand what it's like to fear for your loved one's safety. When the pandemic started, you were all able to shelter at home and protect yourselves, while my husband and these others were out there exposing themselves to an unknown danger. And we knew it was possible for them to bring it home to our then 3- and 7-year-olds. Some of the wives were even pregnant or had new babies at home. In fact, I would implore you to put yourself in my shoes for the last 15 years. Every time my husband went to work to protect you and the citizens of Redmond, I wondered if he would come home hurt or not at all because that was his job. But that was never even a question in our minds. I'll leave you with an excerpt of a glowing review I saw posted online in June of 2020. And to remind you, this was still early on when everything was changing and there was no vaccine. It says, I feel so fortunate to have a team that has responded with compassion, dedication, and courage, assuring that patients' needs are quickly addressed while continuing to protect their safety as well as the safety of all responders. Through all the unknowns, the restrictions, and the fear, the fire EMS providers throughout King County continue to train for future events, adapt to our ever-changing environment. The leadership displayed has set the stage for success throughout the world. Together, we totally got this. That was a post by our very own Union Vice President and MSA, Jim Whitney. So I ask you, what has changed? You hired them because of these amazing qualities. You hired them for their integrity. You invested collectively in hundreds of years, an insurmountable amount of tax dollars into their training and preparation for whatever crisis might come. And the crisis came, and they rose to the occasion. And as Jim Whitney said, they set the stage for success throughout the world. And they did it flawlessly, and now they are being fired. I beg you to try to make sense of that in your mind. I drive by the neighboring fire station every day by our house, and I sob, knowing that Matt would still have a job if he worked for them. In conclusion, he doesn't. He chose Redmond, and you chose him. Like Jim said, together, we totally got this. Thank you.
I'm here asking you today to please reevaluate Redmond's fire department's stance in not allowing accommodations. This isn't about the mandate. Don't let anyone misguide you into thinking that anyone is asking you to go against the mandate. I'm asking you to follow the mandate, which specifically allows for religious and medical exemptions and accommodations, which are protected by federal law. And to be clear, accommodations are a policy issue, not a personnel issue. This board has the power to grant accommodations. Please take into consideration the excuses you are being fed for not allowing accommodations to your firefighters. One is that they might spread COVID and are unsafe to the public. And I want to share with you that every single fire department in Pierce County and 95% of the fire departments outside King County has granted accommodations for their firefighters to remain in their current position and provide patient care as long as they wear the correct PPE, because we know in studies that PPE works. Right now, your Redmond firefighters are not taking COVID tests every day, and they're not required to wear N95 masks on calls unless it's suspected COVID. But we know that unvaccinated people can contract and spread COVID. If those guys with accommodations came back to work, they could literally be the safest employees. They could take COVID tests every morning and wear N95s on calls. Dr. Ray, the very doctor under which all King County EMTs are licensed, has published a paper on how properly fitting PPE eliminates the transmissibility posed from firefighter-patient interactions. So the rationale that they can't provide patient care because it puts the public at risk is completely false. I've also heard that this is King County and it's different here. I want to share with you that Dr. Ray, the medical director by which all King County EMTs are licensed, only recommended the EMTs be vaccinated. He never said it was a requirement. As proof of this, there are multiple agencies inside King County who operate under Dr. Ray who are allowing accommodations in the patient care setting. Boeing Fire Department inside King County and who operates under Dr. Ray has granted 21 accommodations to all of their firefighters and allowed them to remain in their current position. Northwest Ambulance, who is allowing accommodations to all their employees, who also operates under Dr. Ray, even said L&I came through and gave them, quote unquote, 2 thumbs up. So to terminate these firefighters in the name of public safety is not a valid excuse. The very hospital that Redmond Firefighters transport their sick patients to, Swedish, Overlake, Evergreen, have all granted accommodations to their nurses and are keeping them in the patient care setting. So you're going to punish your firefighters in the name of protecting your community, only to bring them to a hospital where they will be treated and potentially treated for an extended period of time by an unvaccinated staff at the hospital. Additionally, the CDC has even given guidance allowing nurses who test positive for COVID to come back to work as long as they are asymptomatic. Sounds crazy, right? So why do they do it? Because the CDC knows and acknowledges that personal protective equipment has been proven to work and protect against COVID transmissions. The question that this board and the fire chiefs have to ask yourself is, how are you going to prove an undue hardship denying accommodations to your firefighters when every single fire department in Pierce County has granted those same accommodations? It's obviously safe for the community, as we have studies that prove our protection equipment works done by our own medical director. Firefighting is not like any other profession. You can't just go back to the trough and hire another one. These firefighters you're about to terminate have a wealth of firefighting, medical, hazmat, technical rescue, skills, and knowledge that is not easily replaced. Trust me when I say, if you were to experience a fire, medical emergency, car accident, or something else that requires a high level of skill, that these are the firefighters you want showing up, because they have thousands of hours of training and thousands of experiences to draw off of to handle those emergencies. This community has invested millions in their firefighters. Do not toss them aside. You do a disservice to your community and that you are elected to serve. As vaccine mandates are dropped, emergency powers are lifted, social gatherings no longer have limitations, vaccine passports are no longer required, and we are all getting back to normal. You have to live with the fact that you chose to turn your backs on your dedicated, highly trained, hardworking firefighters and drove them out of their careers, all because you chose to ignore the part of the mandate that allows for accommodations.
And in conclusion, thank you.
Thank you.
Thank you. My name is Amanda Parnell. I am the wife of firefighter Tyler Parnell. He is one of the 7 firefighters facing termination in the upcoming weeks. Tyler has 10 years of firefighting experience, 7 of that being with the Redmond Fire Department. Tyler works on the ladder truck and heavy rescue, and he is a certified rescue technician. He is also an EMS evaluator and a firefighter safety and survival instructor. I met Tyler in 2015 while he was still a Redmond probationary firefighter. I quickly realized what a passion he has for the fire service. We were married in 2020, and last July we welcomed our sweet baby girl, Oakley Shea, into this world. Tyler has had a strong desire to serve and protect others. To say that he loves being a firefighter is an understatement. 6 months ago, that was all taken away from him due to our religious beliefs. I have had to watch as he struggled physically, mentally, and emotionally. I watched as he lost weight, lost interest in activities that he loves, and see the look of defeat and sadness on his face. As new parents, this first year of our daughter's life should be nothing but pure joy while we watch her learn and grow. She brings us so much happiness, but in the midst of that happiness, there has been a dark cloud looming over us as we deal with the reality that Tyler will soon lose his job. I am a nurse. I work in the operating room at 2 local hospitals, both of which have approved my religious exemptions and have accommodated me in my role unvaccinated. I can provide direct patient care for up to 12 hours with the use of proper PPE, but yet the Redmond Fire Department claims they are unable to do the same for my husband. It doesn't make sense. I can only imagine the pain he feels having not only his career, but his calling stripped away from him. When I became a new mom, I chose to work per diem as a nurse. This means that I'm able to work when I choose based on my availability and the hospital staffing needs. The plan was for me to work around Tyler's work schedule, working 1 to 2 shifts per week, and focus the rest of my time on our family. Unfortunately, if Tyler loses his job, I will have to go back to work full-time and more to make ends meet while he finds another job. This now means that I will spend less time with my new baby and my husband. I will often go to work before she wakes up and get home after she goes to bed. This could mean multiple days in a row without holding my baby. We will have to sell our home and move to another state, taking our baby away from our family and friends. I don't tell you this for your sympathy. I am just trying to give you some insight as to what the last 6 months have been like for us and how our future looks if you fire Tyler and his fellow firefighters. Sadly, our story isn't all that unique. There are firefighters throughout King County that have also been struggling and face a similar fate. His fellow firefighters are his second family. They are the ones who we trust to keep him safe and send him home to us at the end of his shift. Council members, I ask you tonight, please don't take that family away from him. I ask you to put a pause on firing your amazing firefighters. Give yourself time to gain more knowledge and consider reasonably and safely accommodating them in their current role. We don't know what the future will hold for us, but we have our faith, and we know that one day we will look back on this time and see how far God has brought us. We will be able to tell our children about this time, and our current trials and tribulations will be our testimony. Thank you.
Thank you. Items from the audience is now closed. Our next item of business is...
Mayor, Council, my name is David Peterson, and I'm an unvaccinated driver-operator who is currently on an unpaid leave status with my employer, Snohomish Regional Fire and Rescue in Snohomish County. As the pandemic ran its course from fall through the winter, my employer, like many in Western Washington, experienced the highest rate of infection of SARS-CoV-2 it had seen since the pandemic began. Every positive case was from a fully vaccinated employee. At its peak, 30 vaccinated members were out because of COVID. But today I bring a message of hope to the council and to the mayor. Last Thursday, my fire chief, Kevin O'Brien, made the decision to engage with the union to find a safe and legal path for myself and 13 fellow co-workers to rejoin our ranks as firefighters. He stated to the Board of Fire Commissioners, "We want our people back." And we will be meeting with the union next week to discuss bringing our people back safely. That meeting will be held tomorrow. I ask you, be one of the first in the region to keep your firefighters. There is a way back. It's starting to happen all over the state. Please, please reach out to our fire chief, Kevin O'Brien, and just do some research and ask how he's doing it. I know you can work collaboratively to bring your brave, dedicated, and loyal public servants back to work. The job of a firefighter or any public safety employee demands political neutrality. Our mission is to protect and serve the people we come into contact with, regardless what their political, religious, or belief systems are. So why is this being made into a political agenda? I believe the citizens are fed up with overreach and political agendas. Look around at what's happened in the past 2 weeks. Masks are gone from airplanes and public transportation. The state health district denied the COVID vaccine in schools, and you no longer need to show your papers to eat. If this mayor and council decide to terminate these brave firefighters, I believe your political career will be on the line. You will not be reelected, and the lawsuits will come. We will not stop spreading the message of freedom to all within our great country. Please make the right decision. Make a stand, and please reach out to Fire Chief Kevin O'Brien at Snohomish Regional Fire and Rescue. I want you to show the state who the real leaders are, because lately all we've seen is nothing but followers. Thank you. I yield my time.
Ryan Roblard, Redmond Fire Lieutenant, for at least a little while longer. Council members, thank you for allowing me to speak. I'd much rather be working and running emergency calls, to be honest, but I'm here again to implore you to find the will to put a stop to our impending terminations. I have no doubt that Mr. Haney, as the mayor's right-hand man, will continue to bully you into submission with his opinions and state that you have no authority in this matter. Who does Mr. Haney answer to? What is the purpose of the City Council? The City of Redmond website states, the City Council adopts the city budget, establishes law and policy, approves appropriations and contracts, levies, taxes, and grants franchises. We are not easily going away. The city is leaving us with no choice but to continue to stand up for ourselves despite the political witch hunt and apparent personal vendettas against us. The facts do not support our terminations, and any argument against our continued employment can be refuted. Why are we punishing good people? If the answer is simply that we in Redmond cannot be the first entity in King County, public entity in King County, to accommodate our firefighters in their positions, please tell me how that is following the science and not just political. Please take the time to investigate this properly, reconsider the decisions that are being made, and do the right thing. I'd like to address last Tuesday's Committee of the Whole meeting where Councilmember Anderson requested numbers from the Finance Director and Chief Shepherd regarding the costs associated with this policy decision. Both directors deferred a timely response due to being overstretched. I believe Mr. Corder needed 30 days or more. Not surprisingly, without any action taken, we should all be terminated by then. I was disappointed Chief Shepherd was unwilling to provide even an overview of the impact of this decision. As it relates to overtime, the amount of overtime expenditures during similar time periods over the last 3 years shows roughly a 300% increase from 2 years ago and a 200% increase from a year ago. During the first 4 months of this year, suppression overtime is costing nearly $300,000 per month. Decreased staffing, COVID illness amongst the vaccinated workforce, and burnout from being overworked are contributing causes. A side effect is low morale. All of these combined leads to more sickness and injuries and more overtime. The chief could have been forthcoming about the cost of replacing us by highlighting the expense of hiring and interviews, the cost to outfit all new firefighters with custom gear and uniforms, putting them through an EMT course in Eastside Fire Academy, which adds additional costs outside of their salaries and benefits, and taking 2 to 3 experienced firefighters off the line to instruct, creating a need to backfill. Removing 12 experienced firefighters, including 7 supervisors, in exchange for new recruits has a significant effect and may not show on a spreadsheet, but is a cost. None of these costs, which are millions of dollars, were necessary. There would have been no undue hardship to honor the accommodations negotiated and agreed upon that allowed us to work in our positions like we did for the 20 months prior to October 18th, and so many others continue to do today. The lack of transparency relating to the costs upon the city due to the mayor's decisions have and will continue to affect the city negatively. As you know, there will be litigation. Tort claims currently filed with the city total over $70 million. The council should also be very concerned about possible damage caused to the relationship between the city and Fire District 34 due to the way that this has transpired. As the contract comes up for renewal, it would be wise for the council to reach out to the fire commissioners. As the city attempts to put forth an emergency services levy asking for more funding, be acutely aware of how fiscal irresponsibility is not a selling point to the taxpayers who are our employers. So to conclude, please reconsider the human cost of continuing down this road. Don't let Mr. Haney hijack this process. Find the correct mechanism to stop this action in its tracks and allow time to investigate these claims and whether we should be terminated based on what we know now.
Hello, my name is Tracy Robillard, wife of Lieutenant Brian Robillard. I'm here to invite you into my world of confusion with the city of Redmond and their fire department. And I'm going to ask you to help me make this make sense. My husband, Lieutenant Brian Robillard, was told that he could not continue to do his job as the training lieutenant, a non-patient facing position within the fire department, once the mayor's executive order was issued. But then the city offered Brian his job back months later as his own accommodation, with a pay cut, although he took a pay raise when he accepted the position of training lieutenant. Confusion. The pay cut was explained that it had something to do with his EMT cert, which makes 0 sense as Washington State allowed Brian to keep it active. And those in the fire prevention, another non-patient facing position, did not receive a pay cut, actually just the opposite. Every time that it was asked of Brian if he would like this position, Brian replied to the city that yes, he would like this position, the job and title that he currently held with the fire department. Let him go back. At no time did anyone tell Brian, great, the job is yours. You know the job. You've been doing a great job in that position for nearly the last 2 years, and we're excited to have you back. Brian and many others in this group that we belong with put their names in the hat for these 11th hour positions / accommodations, and were eager to hear who would be keeping their employment with Redmond. The city was supposed to let all interested parties know this exciting information on December 17th, but that business day came and went. We were told that the news would then be released on December 21st, only to hear that those jobs would not be awarded until those interested parties were off leave. Again, when Brian and the others came off leave, they all stated yes, they would take the offered position. Brian's job, training lieutenant, was listed as a vacant inner-city job posting, so we just knew that someone within our group would definitely be getting this job and would be able to stay employed with Redmond Fire. I deep down knew it would be Brian, because he was the last one to hold this title. Do you know what happened? Chief Adrian sent an email to Brian and all interested parties stating that there was no work available. So I ask you, make this make sense. The job that Brian had but couldn't do unvaccinated, that was then offered to him as his own accommodation, but when he technically was eligible for the vacant position, there was no work for him? Even though it was listed as a vacant job posting on the city website. Tell me why Brian was ever told to stop coming to work. I'm going to move on. Let's make this make sense. At the end of a pandemic, when the viral caseload is so low that the state has done away with indoor and outdoor masking policies, when King County has done away with their vaccine passport program, when the FAA has done away with the mask mandate for plane and train travel, when our King County Medical Director, Dr. Ray, has done away with masking and testing within our fire departments in King County, the city of Redmond is willing to fire amazing fire staff with unblemished work history. Obviously, it'll be costing the city millions in overtime, new hire expenses, and future litigation payouts. Again, it's a little over $77 million filed against the city right now in tort claims. So, council, the city website that I printed out says that your job is provide the mayor direction on policy goals and objections. I could go on and read the rest, but I'm going to say this. This is not a staffing issue. When you have an executive order that directly affects a group of people, this is a policy issue. I want you guys to hear that. It's a policy issue, and that's your job. So I'm asking you to do the right thing. Do the job that you've been elected to do. Do the job that you know you have the authority to do, and put a stop to any further terminations. Remember who Mr. Haney works for. Thank you.
There's a moment in time where we can stop and pause and reevaluate what we're doing, whether it's a team or the family or the city. And so I want to bring a message of healing at a time of where we're getting past COVID, and I believe that we have an opportunity to bring healing to our fire department. So I'm Frank Dahlquist. I'm part of a group called King County Firefighters United. We're part of a larger group of Washington Firefighters United as well. And this group is made up of vaccinated and unvaccinated firefighters. They're advocating for our members. And at this moment, we're at a precipice, right? We are at a time where King County fire departments are releasing their firefighters from service. And, again, if I was to describe what they think about this time and what it's doing to their families, it's very difficult. So this can be a time of healing. And I think we just heard from about your public survey at the very beginning, where public safety was ranked number one. And I think if you're to consider that, then we also have to consider that firing these valued members in our community is wrong. Dr. Fauci recently has been going on television talking about how we're living with COVID now. And I think as a community, we are ready to heal as well. We can do this safely. And why I can say that is because we have already been doing it safely. For many, many months, almost 2 years, we've been responding to calls as firefighters safely with PPE, with daily testing. But October 18th, that wasn't good enough for some reason. And what we're asking for now is a pause to just reevaluate the process, reevaluate the budgetary impacts, reevaluate our accommodations so that firefighters can continue to work. We also are now recognizing natural immunity, recognized by the CDC, NIH, and as well as our own Dr. Ray, who is being used by our fire chiefs and our cities to say that it's because of his recommendation that we're firing these firefighters. Now, I have a natural immunity. I got sick with COVID in September. I had a bout of pneumonia, and I returned to work afterwards, just like every other firefighter that I know. Now, the one thing that I did differently was I joined an antibody research study in Seattle at Fred Hutch. And they've done an amazing job. Every month I get my blood tested, I get my results a few weeks later, and it has shown robust natural immunity time and time again. What we know about the vaccines, though, is that it does wane over time. And what we're seeing now with the booster that may only work for a few weeks, and the fourth shot now, as many studies are showing, may not have any effect. We have to remember that that vaccine was based off the Alpha variant. And what are we now? We're so far into this that it's not even designed for what we're seeing in our communities. But we also are seeing is that the numbers are so low. Nationally, locally, it's the same thing. The lowest hospital count that we've seen since the beginning, the lowest infection rate that we've seen at the beginning, and the lowest death rate from the beginning. Again, what we can now say is that what we thought we knew before has changed, and now it's a time to reevaluate. And let me go back to Dr. Ray, because he's being used as the person to justify this whole process of terminating firefighters and how we can't have accommodations for patient-facing. Now, Dr. Ray, in last year's infectious disease training for CBT in King County, he has a little video on there. And if you want it, I can share it at any point. And in this video, he recognizes natural immunity and he recognizes herd immunity. And his definition of herd immunity was 75% or greater of either natural or vaccinated immunity. Well, in our service areas right now in King County, we all know the vaccination rate is high.
And in conclusion?
Thank you. And the herd immunity is right there. So at this point, we can take his own advice and keep our community safe and bring our firefighters back. Thank you.
Mayor Birney, I hope you'll listen. I have a request for you at the end of this. I appreciate your attention and everyone else, your time. I'm Tom Fry. I'm a business owner. I'm a King County resident. I'm a 26-year past employee of Aerojet Rocketdyne here in Redmond, Washington. I care a lot about this issue. As a rocket scientist, I've come to the conclusion that it's safe for unvaccinated firefighters to work as first responders. So do you have to be a rocket scientist to come to that conclusion? The good news is no. You really just have to focus on two facts. First, vaccinated and unvaccinated firefighters can get and transmit COVID. Fact. Fact number two, firefighters can provide direct patient care safely with proper protective gear and procedures. These are two undeniable facts. I'll back this up in a moment, but just think about that. You only need to know two things, and they're simple, and they're undeniably correct. Regarding fact number one, vaccinated and unvaccinated firefighters can become infected and transmit COVID. We have all heard of people and know of people who were vaccinated, boosted, and got COVID. Call them breakthrough cases. No one can dispute this, that vaccinated firefighters can become infected and transmit COVID. This is why firefighters were being tested for COVID and using PPE procedures. Because of this first fact, the second fact is very important. Point number two, or fact number two, is firefighters can safely deliver direct patient care when using protective gear and procedures. I'll back this statement up. In August of 2021, the U of W Medical Center published a report led by Dr. Thomas Rea, Program Director for King County Medic 1. The study concluded steps can be taken to prevent transmission of COVID to and from the public. Data from 3,000 EMS workers in King County, the very firefighters you are firing, was studied from mid-February to early July of 2020, when vaccination was not available. So these were unvaccinated firefighters they were studying. There were a total of 3,700 encounters with patients infected with COVID that could have transmitted them to EMS workers. The conclusion from this study, and I'm quoting from Dr. Thomas Rea, our findings should help reassure first responders that emergency care in general, and specifically when performing aerosol generating procedures, can be safely delivered to patients as long as personal protective gear is properly deployed. This proves just how effective PPE can be at preventing and transmission of COVID between firefighters and patients. There is no medical basis for the necessity to fire unvaccinated firefighters. Has something changed since 2020? The only thing that's changed is more transmissible variants to COVID. What hasn't changed is the tested and proven PPE and procedures. Other places in Washington State and other organizations in King County are allowing unvaccinated care providers to do direct patient care. One example, my wife is a charge nurse at Evergreen Hospital in Kirkland. This is a public hospital. She has coworkers that have received medical and religious exemptions. She knows this because they've shared with her the approved exemptions. There is no accommodations needed for these nurses because they're already using proven, tested PPE measures and procedures. Mayor Birney, I want to believe that the facts matter and that your mandate is not punishment or politically motivated. Please show us that facts matter and government works and allow unvaccinated firefighters to return to their jobs.
In conclusion, thank you.
That's it.
Good evening. How's everybody holding up? My name is Randy Fay, and I'm here of my own accord. I'm not here representing my employer, my fire district. And I'm not here to criticize you. I'm not here to question what you've done. I'm just here to share a story with you. I work at Overlake Hospital. I'm their emergency manager. I spend every day with 3,000 employees that just talk about this issue. I'm the vice chair of the Snohomish Regional Fire and Rescue Board. I spend all my time talking about this issue. I'm the president of the Snohomish and Island County Fire Commissioners Association. I spend all that time talking about this issue. So if you think you're sick of it, try walking in my shoes. We have a mirror image of your situation in Snohomish County. We are only one of 3 fire districts that made the decision to follow the governor's mandate, whereas you kind of have the mirror image of that in King County. We're the largest fire district in Snohomish County geographically, and I'll explain why that's important in just a minute. I, too, have had to sit where you sit and listen to an impassioned number of firefighters, citizenry, criticize our actions, question our personal integrity, question the integrity of the department. And I know it gets hard. We have commissioners that will no longer engage with the firefighters that we have on leave. We started out with 40 firefighters, which is 15% of our force, requesting accommodations. And I remember sitting in your council meeting last September when you made the decision to rescind your accommodations, and I was sitting back there thinking, oh my God, I'm glad I'm not sitting where they are. 2 weeks later, I had to vote to do the exact same thing. So karma, I suppose. Our reasons were probably different than your reasons, and we've all listened as folks have talked about the medicine issue, and we know that's changed. But you know, as elected officials, it's not all about the medicine. It's about risk management. It's about fiduciary responsibility. It's about insurance coverage and all those kinds of issues. It's a big, I once heard the analogy of 9 blind men trying to describe an elephant by feeling a different part of it. So I just want to bring this to a head here. If I had to vote based on what I knew last October, I would have voted the same way. It was an incredibly hard decision, painful, after hours and hours and hours of analysis. As has been mentioned to you, we are finding a way back. These meetings are going on in our district. And the geographic thing is important because every district that surrounds us has unvaccinated firefighters. And because we're so big territorially, we have to take mutual aid from every department around us and have mixed crews. And our numbers continue to go down. Our infection rates have not gone up. That was part of the discussion when we put measurables in place to say, now, based on the advice from our attorneys, our risk managers, our doctors, we think we can move forward. And as I represent commissioners all over the two-county area, these conversations are going on. Things are starting to move. How am I doing on time?
You have 4 seconds.
Oh, okay. Well, thank you very much.
Thank you.
All right, September 20th, 2021, in an email from Mayor Angela Birney to the entire fire department, she states, "The city will allow for medical and religious exemptions from this mandate. However, please keep in mind the difference between an exemption and an accommodation. For example, suppose an employee chooses to be unvaccinated and is legally prohibited from performing their work based on the vaccine mandate. In that case, the city will try to accommodate the employee in a different role. If accommodation is not viable, an employee has 2 choices: be vaccinated or separate from city employment." The federal CMS mandate guidance, consistent with Washington state mandate, reads, "Under federal law, including the ADA and Title VII of the Civil Rights Act of 1964, individuals who cannot be vaccinated because of a medical condition or sincerely held religious belief, practice, or observance may be entitled to an accommodation. The federal EEOC religious discrimination guidance on providing accommodation reads, Title VII prohibits covered employers, employment agencies, and unions from engaging in disparate treatment and from maintaining policies or practices that result in unjustified disparate impact based on religion. Different types of fact patterns may arise in relation to Title VII religious discrimination that include taking adverse action motivated by a desire to avoid accommodating a religious belief, observance, or practice that the employer knew or suspected may be needed and would not pose an undue hardship. Every King County Fire Department knew or could have suspected that testing and masking may be needed for exempt employees to continue safely working as proven by the accommodations listed on the approved religious exemption form signed by HR Director Laird and COO Files. They engaged in disparate treatment by maintaining policies that resulted in unjustified impact based on religion. Every fully vaccinated fire department implemented universal testing and masking policies after the mandate went into effect during the Omicron wave, but religiously exempt employees were excluded. April 5th, 2 weeks ago, City Attorney Mr. Haney said, "If you were asking to amend the personal manual, yes, you can amend the personal manual. The code does say that. Your amendment would have to be consistent with state law and federal law. I propose that the solution to providing immediate relief to these struggling workforces and hemorrhaging budgets, saving the careers of countless amazing firefighters, and eliminating the litigation risk of the employer is to uphold the law. You do not need to do anything special or unique. You do not need to implement special provisions for firefighters. You need only demand through policy clarification that the city uphold federal EEOC and Title VII law under the existing mandates in place. It has been stated many times over that the City Council does not make personnel decisions. Instead, it has been asserted that your oversight is limited to policy and finance. I would challenge that these 3 areas of responsibility do not live mutually exclusive to one another. Quite the contrary, ambiguous and poorly defined policy allows for personnel administration decisions resulting in significant financial consequences. I urge you now, uphold the law, clarify the policy, ensure good financial stewardship to the citizens, save the careers of myself and these outstanding fire department employees, allow us all to continue providing our constituents with the world-class service that they know and expect."
Good evening. Bear with me, I'm going off script. I spoke with an attorney right before coming into this meeting. He's also a council member in his hometown, and he did some research on our city. There's been much discussion around the vaccine mandate and the impacted firefighters. It's been asked a couple weeks ago, is there anything that we can do that could affect these firefighters? You were told, no, there's nothing we can do. In the last 4 weeks, you have been given and shared with a great amount of information from the community, legal counsel, affected employees, and their families. I believe that we have made a strong case that there is a lot that can be done. There's a lot of avenues moving forward to right the wrongs, to uphold the law, to reevaluate the situation that rose during emergency powers of a pandemic. The City Legal Counsel continues to tell you that you don't have the authority to do anything. You don't have the authority to pose a resolution. You don't have the authority to put a stay on a motion to pause terminations. You were told by the finance director that it's going to take months to give you a full analysis of the costs that have been incurred, and probably longer for those that will be incurred if you follow through and allow these terminations to go into effect. If the elected council has no authority for checks and balances within government, what is the council here for? I understand that emergency powers were used during a pandemic to make a policy based on current conditions at the time. You've recently, in the last few minutes, been emailed a part of the RCW, Chapter 2.20, Emergency Preparedness. Within that document, powers and duties are clearly spelled out. The mayor's duties include making and issuing rules, regulations on matters reasonably related to the protection of life and property as affected by such disaster, provided, however, such rules and regulations must be approved by the Emergency Preparedness Council and confirmed by the City Council at the earliest possible time. Have you confirmed the emergency powers that were used during a pandemic? 2.20.030, City Council duties. You are to give advice to the mayor regarding appointments, situations relating to emergency preparedness. And, subsection C, approve at the earliest practical time after the issuance, rules, regulations reasonably related to the protection of life and property, which is affected by a disaster, such rules and regulations having been issued by the Emergency Preparedness Director, the mayor. I believe that you've been given 3 options tonight of how you can right this wrong or choose to save the employment of your valued firefighters. 1, you can put a stay on terminations. 2, you can propose an amendment to the personnel manual as clearly stated by the city's attorney 2 weeks ago in this very room. Require the federal law be upheld. If it's an undue hardship, you must provide objective facts. No objective facts are being given. And number 3,
in conclusion,
you have the authority to approve at the earliest practical time the issuance of an emergency regulation. Do you approve?
And in conclusion, thank you.
City Council, thank you for hearing us today. My name is Dan Webster. I'm with Washington Civil Rights Council. The Redmond Fire plans to terminate unvaccinated firefighters based on a claim that they said their firefighters pose a health risk to the public. Specifically, they are said to pose a direct threat or infection when in proximity to others. Redmond Fire claims that religious accommodations requested by firefighters are too burdensome to the fire departments, thereby creating undue hardship. These reasons for discriminating against otherwise capable, healthy, and dedicated employees of King County have already been discarded by fire departments outside of King County, such as Pierce and Thurston counties, which are bringing back their unvaccinated firefighters safely. An employer that an employer can only deny reasonable accommodation to an exempt employee if doing so creates an undue hardship or undue burden for the employer. And the employer bears the onus of demonstrating that by being unvaccinated, an employee creates a burden to the employer's duty to provide a safe workplace. However, federal courts hold that when an employer denies religious or medical accommodation on the grounds of undue hardship, any hardship asserted must be real rather than speculative or merely conceivable or hypothetical. This is Brown versus Polk. So, on its COVID variant webpage, the CDC actually states that, if you look today, that scientists are still learning how effective COVID-19 vaccines are at preventing infection. So, in their own words, based on the fact that Omicron is currently predominant COVID strain right now, based on CDC's own words, scientists are still learning. Any implied increase in the risk of virus transmission from firefighters' continued employment with the agency is unknown, not measurable, purely speculative. In light of the above stated facts, any attempt to deny religious accommodations based on a claim of undue hardship is at this time legally unsupportable. So I ask you, and you're about to make a decision here, have the mayor and the fire chief provided you that support of undue hardship? Have they provided you specific information? Have they given that to you that supports this idea of undue hardship or direct threat? The law states employers have the duty to prove and investigate real claims of undue hardship, direct threat. Have they done that? If you don't feel like you have enough information to make that decision, or the clarity on this topic is not clear, this is a very impactful issue. Give yourself time, grant a stay until you have that information, and don't let anyone bully you into making a yes or no vote.
In conclusion?
Until you have that information. Thank you very much.
My understanding is that the termination of our wonderful Christian firefighters boils down to people believing in the media propaganda. If you've been jabbed, you're safe. If you've not been jabbed, then you're dangerous. This is so wrong and it's ridiculous because it's not true and it's divisive to Redmond. So let's listen to the science and the truth. CDC Director Walensky stated on CNN, what the vaccines can't do anymore is prevent transmission. So in other words, if you've been jabbed and you know who you are, then you could be a spreader. Dr. Anthony Fauci said on NPR, we know as a fact that vaccinated people with COVID-19 are capable of transmitting the infection to someone else. So in other words, if you've been jabbed, you could be a spreader. The 2008 Nobel Prize winner in medicine, Dr. Luc Montagnier, he said, the vaccines don't stop the virus. They do just the opposite. They feed the virus and they facilitate the development into stronger, more transmissible variants. So in other words, if you've been jabbed, you could be a spreader. Dr. Martin Kulldorff, professor of medicine at Harvard Medical School, the bottom line is that these vaccines do not prevent transmission. In other words, if you've been jabbed, you could be a spreader. Dr. Sunetra Gupta, infectious disease epidemiologist at University of Oxford, he said, it is really not logical that to use these vaccines to protect other people. I don't think they should be forced simply because this vaccine does not prevent transmission. So if you think the logic of it, What is the point of requiring a vaccine to protect others if that vaccine does not durably prevent onward transmission of the virus? In other words, if you've been jabbed, you can be a spreader. Well, I'll tell you who's not a spreader. It's our wonderful Christian firefighters who've not been jabbed. They have the very, very best and safest defense against COVID because they got COVID and now they have natural immunity. Dr. Jay Bhattacharya, an MD and professor at Stanford University, he was speaking in regard to the recent COVID vaccine policy, and he said, based on my analysis, any policy that does not recognize natural immunity is irrational, arbitrary, and counterproductive to community health. Dr. Martin Kulldorff, professor of medicine at Harvard Medical School, said prior COVID infection provides better immunity than the vaccines, so vaccine mandates are not only scientific nonsense, they also are discriminatory and unethical. Dr. Fauci says the most potent vaccination is getting infected yourself. A very recent study by the CDC on January 28th shows that those who have recovered from COVID-19, and that includes our wonderful Christian firefighters, have more protection against COVID infection than the vaccine-induced immunity. So the bottom line is terminating our safest firefighters is evil and harmful to the residents of Redmond. The natural immunity firefighters are safer than the jabbed firefighters, so there's absolutely zero justification for their terminations. And these completely unjustified terminations are setting up Redmond for an enormous lawsuit.